Far. All right. So today, what I think we're going to talk about here is getting more out of the CPT. We spent get rid of this thing. We spent a lot of time talking about gait, how to analyze gait, and some of the connections that we will see between the brain and the gait because they're very intimately associated with each other. But for this one, I wanted to just focus mostly on the CPT exam, the Conners Continuous Performance Test, so that you can look at that in itself and try to understand a little bit more about what it's telling us. And I know we've talked about a little bit in fatigue and a little bit in potential of overuse stuff. But let's dive into this and see what we can talk about, where we can find focus in baselines, where we can find potential areas where an athlete may fatigue as a predictive measure, and then kind of review some of the things we talked about with risk factors, the particular injuries, because all of these things start in the brain. Winning, losing, mindset, all of these things are interrelated with each other and will have a direct impact on how an athlete moves through space. So the Conners Continuous Performance Test has been around for a really long time. It was came out for in the late 50s. It was originally designed for attention deficit issues, and then it sort of got brought into uh, the traumatic brain world, looking at concussion things, and then got taken back over by the attention deficit world, and now sort of come back into um, the traumatic head injury world as well. So it's become a really important test, a very valid test to measure multiple metrics of attention and inattentiveness, impulsivity, sustained intention, cognitive endurance, all the things that we really need to be able to perform, no matter if we're in school or if we're in a sport. So it's really high level executive function test that is a lot of different applications and a lot of different places. And we use it in the SportGate app as the 7-minute cognitive test, which is we've published tons of validation studies looking at the shorter 7-minute version that we use as being really super predictive of a lot of issues that we'll see. Again, with SportGate, really what we do is you open up the continuous performance test. Your task is to hit every letter except X. And as you go through the 7 minutes, the letters come at you at a different pace, and they will come at you faster, and they will come at you slower, and then they will have increased time between the letters and then a decreased time between the letters, which will stress all the different areas of your visual spatial memory, your memory, working memory, attention span, cognitive endurance, all of these things. A very robust test. And if anyone, I've taken it a number of times because, like I told everybody, this is like everyone who comes into my house gets a sport gate, but it's 7 minutes. It's a no joke test. It really is a very heavy cognitive stressor, which is great when we start using it as a pre-fatigue test for gait. What we're really looking for here are different patterns of attention, and we have two things that we really look for with the CPT. One is impulsivity, and one is distractibility. So we're looking for faster than average hit reaction times, high commission errors, and increased preservations, which is repeated responses within short intervals following sort of a lack of inhibition control, which shows impulsivity, which is different than distractibility, which is, you're not paying attention and being in different places where you're missing targets due to a lapse of attention, inconsistent response times due to the fluctuating amount of attention that you're paying to um, the task of the Conners test, and distinguishing between targets and non-target stimuli for distractibility. These two patterns are particularly helpful when we're looking at how an athlete may perform on in competition. Where we have impulsivity is rapid responses leading to errors, missed targets would be distraction, variable reaction times, and how this sort of relates into um, how we would treat an athlete when we start seeing these patterns, which we'll go through in a minute. If we recognize these patterns and we see how that can affect athletic performance, we can develop targeted interventions that we can do as part of the athlete's training to help improve their attention span, improve their ability to be less distracted, to be less impulsive, by incorporating some cognitive work into whatever training program that you happen to be working on for them. Remember, we've seen this slide before, and how the brain interacts with the outside world is through the integration between multiple parts of the brain. But we really want to think of a big overview of the prefrontal cortex, which is kind of in the front of the head near the eyes. Is that's telling the body what do I want to do? I want to throw this football or kick this soccer ball. The parietal lobe, which is kind of at the top of your head, is the motor program that tells you, okay, this is how you do it. That information is then fed down into your cerebellum, which is receiving input from the top part of the brain, your spinal cord coming up, and in from the cerebellar inputs that kind of coordinate it into this is how you do it. So it becomes a very refined motor function, opposed to something crude that starts out from the prefrontal cortex as just an idea. The parietal lobe is a concept of how I'm going to go throw that football or kick that soccer ball. And the cerebellum smooths that out into a very coordinated, learned motor output that allows you to be efficient, moving in space. So it synchronizes all of the sensory information coming up from our proprioceptive world and our joints and skin and all the ascending sensory fibers, integrates the information that's coming from our inner ear for vestibular issues, and it's also integrating information that's coming in from our eyes and our occipital lobe to help refine that motor program that we're putting out. This area here is a highly functioning area of the brain that's heavily involved in our executive function. So these are areas that we're sort of hitting when we start doing the Conners continuous performance test. And how that sort of relates into movement when we're testing the integrity of that executive function system is that there are particular coordinated parts of the brain that work together to produce gait. And we see from this picture that I stole from the paper that's from Neuroscience and Behavioral Biobehavioral Reviews a few years ago. I think it's a really great illustration to show you how the different parts of the brain work in different parts of the gait cycle. And the first one, we have the frontal lobe, occipital lobe, and cerebellum working for gait velocity, which is really kind of what we just talked about, keeping our gait smooth and moving. The frontal lobe, what I want to do, parietal lobe coming in and saying, this is how I do it. Occipital lobe with visual information, and the cerebellum integrating it all out through the basal ganglia and hypothalamus, which are another part of our fine tuning of motor functions. Um, the step length is also how we integrate a lot of proprioceptive information, stuff that's coming in, telling us where we are, how we have to navigate. A lot of our step length is learned motor functions, so it would be no surprise that areas like our limbic system and hippocampus are involved in that, as they are really heavily involved in working memory. We get to see, we'll look at the step time variability. That's really a parietal lobe and a hippocampus issue. Again, learned motor functions that we have stored in our parietal lobes that come from our hippocampus that help smooth and integrate what we've learned versus what we want to do. Step width, another conserved area that involves our working memory, our parietal lobe, which is our motion, cadence, and interesting. I'll go through all these, I guess, now. The double support time coming from the sensorimotor and parietal lobe, which is really how trying to understand proprioceptively, like where we are in space, how much time we're spending on double leg support. So these are the areas that when you do the Conners continuous performance test, we are directly interrogating the ability for these areas of the brain to do these specific functions. Can we do gait velocity, step length, step time, step width, cadence, double leg support time? How are those parts of the brain working together? And as we go through the Conners test, these areas will fatigue out, and we will see problems with these areas that will show us, will reflect not only in the Conners test, but also in our inefficient motor functions. One of the things that I think is really important when we go from looking at baseline work when we're talking about concussions, because like I told you, my story is I started using Sportgate when I started working in concussions and using it as a baseline, where if you do look at the output, you'll see primary indicators and secondary indicators. And as we move away from, in your practice, moving away from using the Conners continuous performance test as a concussion baseline and return to play tool, which it's great at, but using it more as a general health and wellness tool and how was my athlete at baseline, because we can always find areas to improve our cognitive and motor function in our athletes, to kind of stop thinking about when you're viewing the report as primary and secondary indicators and start putting the picture together of how the cognitive functions that we just went through relate to what we're seeing as output in our motor system. So this chart here shows you some of the areas that I really look at and what they mean. Hit reaction standard, hit reaction time standard deviation, obviously is the consistency of reaction time over time, and that really plays into our gait symmetry. And that's side to side sway or vertical up and down. Why it matters, we have variability in timing, variability in step pattern, and the fatigue will build over time and we'll lose motor precision as we go. Again, reflecting back to what we just talked about in particular areas of the brain that are involved in gait symmetry. Commissions. This is premature responding, shows poor inhibition, rushed, uncoordinated motor firing can be associated with that. And so with those, we're going to see lateral power issues, sway or trunk control. Omissions, which are missed targets, are telling me that we have lapses of attention. Stride, swing phase imbalances will be what the gait correlate will be. And that's really just attention dropout and incomplete or erratic motor sequences. And we've seen some of this in some of the fatigue issues and injury predictors that we've gone through. Variability is a big one for me. Variability really tells me there's asymmetry. We went over asymmetry and smoothness last week. And that will see variability across all of the CPT components, not just in emissions, commissions, hit reaction time, and those sort of issues. Whenever I see asymmetry, it tells me there's an inconsistency somewhere. We're losing motor rhythm, we're losing coordination. There's a timing issue, and we'll see that in the Conners test. We'll see it in the gait, and you can put them both together when you start looking at your athlete in a holistic way with these tests. The interstimulus interval, which is the amount of time it takes for each letter to show up. That time changes, and you have to be adaptable to that time. When you start seeing poor adaptability, particularly as the test goes on and on and on, we're talking about somebody who's going to fatigue, breakdown of motor function, and you'll see a lot of the issues that we've talked about in the last few weeks start to show up. So when you look at your baselines, start thinking more of the holistic idea of what we're really trying to look at. We're trying to look at all those areas of executive function that control our motor function to kind of give us a prediction of what we're going to see in a gait analysis, and target some specific things that we'll see here in a minute with, again, inattention and distractibility that help us with our athlete. Why it matters when we're talking about athletes, we've seen this slide before, is that when we have deviations in these CPT metrics, things like hit reaction time, why it matters in sports is, quick decision making. If our reaction time starts to decrease over the time of the CPT, then we're going to have difficulty making decisions towards the end of a game, or a match, or whatever the competition may happen to be. Omissions, we have loss of focus. And this is when we'll have drop balls, lack of paying attention, mental errors that you see late in games from fatigue, cognitive fatigue. Commissions, same kind of thing, poor inhibition. These are the things that we're going to see with late in games, jumping off sides, fouls, silly fouls, stupid penalties that you see because you're poor inhibition, you're fatigued, and if you have a propensity for omissions, distractibility, or commissions, poor inhibition, and we see that in a cognitive test, I know that athlete is probably going to be prone to those type of things throughout the course of whatever competition they're doing. So I'll incorporate some things into their training program to help train those lack of focus and hyperactivity kind of movements to prevent these sort of errors coming down. Hit reaction time and variability. You start seeing variability, poor execution late in games. mental fatigue. You'll start to see if they become start seeing a lot of variability. Variability is a breakdown, and always go and look for the particular patterns of breakdown that we're seeing. Preservations means repeating mistakes, and that's somebody with reduced adaptability. And the thing about the Conners test, as you go through those different time blocks, through those 7 minutes where the time between the stimulus varies and you have different blocks of time, we are having a really difficult time switching tasks, switching from one speed to the other. And that shows that if you start having a lot of mistakes as the blocks are switching, we don't have a really great uh, resiliency in terms of adaptability, being able to go to a hurry up offense or play against a hurry up offense, transition to a fast break basketball game, or a really great cross in soccer that's going to shift the play to the other side of the pitch. These sort of reduced adaptabilities to changing environment and the things that we'll see early in the even a baseline cognitive testing in athletes. Again, if you see when you do your baselines and you see something that's an indicator, and sometimes it's very tempting to just not worry about it until you have a concussion, because on baselines, we hope that none of these athletes on baseline have concussions. It's telling you that there's something there that can be fixed. There's an intervention that can be performed. There's something that needs to be paid attention to so that you can optimize the athlete's performance. And with the CPT, these are really the patterns that we're looking for. We're looking for decision making, attention, and being able to very quickly change tasks or alter performance based on the needs of a game or the pace of a game, particularly as it moves on in time. Um, Executive function in sports IQ is huge. I use, I guess we talked about the Conners continuous performance test is really a proxy for executive function and executive control. How am I able to control my cognitive focus while I am in the middle of doing a particular task? In our case, is playing sports. It shows us mental stamina, particularly under pressure, because if the athlete is taking the baseline test and putting the effort into it, it's going to fatigue them. We're going to see how they perform under pressure, because at the end of that 7 minutes, they're going to be pretty fatigued. I say that this executive function in sports IQ is particularly relevant for for relevant for all athletes, but particularly our athletes that are the decision makers on the football field. I'm very kind of American football focused, so I think about quarterbacks, and European football. We talk about midfielders, people that have to change offense, defense very quickly. Point guards in basketball, and even in individual sports, in tennis and other individual sports where there's a really heavy strategic component to it. This will show me how well someone is going to be able to make a decision at the beginning, middle, and end of a competition. So our decision makers are the ones who um, seem to have the strongest correlation here. But all athletes eventually, at the end of the day, make a decision: am I blocking? Am I pulling? And the defenders, am I dropping back? Am I moving into space? So essentially, all athletes are decision makers, but the really heavy decision makers seem to um, have a really high performance on a CPT across the board. So when we're looking, this is a little bit of review from putting some of the things that we've talked about toward and gait, and kind of redirecting those thoughts towards when we look at the CPT in and of itself. Our first signs of fatigue in athletes are when if you're doing repeated testing, is going to be increased hit reaction time variability. And that's going to show you that their focus is poor, that they're not able to pay attention to the task. So you're going to have a moment where they're paying attention, their hit reaction time is consistent. Then they don't pay attention and it's slower. Then they pay hyper attention because they realize they're not paying attention and it gets a little faster. So variability, any sort of variability, really tells me we're really seeing early fatigue coming on. We start seeing increasing number of commissions. We're looking at athletes that have poor inhibition, declining hit reaction time. If they're slowing down as the process goes, then we're having a cognitive slowdown. We're really talking about the kind of more more pronounced end of cognitive fatigue. um, in those athletes, and a lag in task switching, which will give us, which we measure in preservations, um, will tell me again what we talked about. We don't have the ability to switch tasks. We can't think, move, we can't adapt to a cross or a fast break or hurry up offense. We're too rigid. We don't have the fluidity in our ability to be able to cognitively assess and react to what it is that we're interpreting, whatever sport we're participating in. Um, we talked about symmetry and overuse last week, and we talked about when we start seeing symmetry collapses during our gait assessments, particularly post-turn. We can see those in the CPT as well, and we can see them a little earlier in the CPT. When you're doing your baseline, you start looking for the metrics that we just talked about. You will also start to see loss of symmetry in our gait. Impaired attention. We'll see misloading on one side. And so these are the kind of things that we want to try to correlate with what we're seeing when we're doing the full holistic gait analysis. So with athletes, we're going to go through a couple of cases here. There are many different ways, as sort of alluded to, that you can use this in an athlete. Baseline testing is great, and particularly, again, we talked a lot about the specifics of gait abnormalities, but for cognitive profiling as well. If you do a baseline on an athlete and think about it in its separate own entity, you get a cognitive profile of what that athlete is and how they're going to respond to things. Are they distractible? Are they not paying attention? Do they have impulse control issues? Are we losing adaptability? And you can see that even on our baseline CPT without any cognitive injury, without a concussion, without anything happening. This is the way that the athlete's brain works, and that's their baseline. And our idea is to take that cognitive profile and put interventions in to improve it. We can use it throughout the season as well to monitor fatigue, which we've talked about a number of times. I like to do a sport gate at least once a week on an athlete to see where they are. Sometimes I'll do it multiple times in a week if I'm really worried about somebody and I want to see how their recovery is going or how their training program is moving them along. Return to play, we saw with the ACL case last week. We can use that again to return to play. How is this athlete feeling? If we start seeing things in, I should have shown you the cognitive test on an athlete, but we start seeing things that show us those same kind of patterns of lack of attention, lack of adaptability in athletes who are going back to sport who had been out for a long time, such as somebody with an ACL injury. Then we want to start thinking about getting that brain back engaged in what they're doing, and that not just with concussion, but with anybody who's been out for a period of time with any sort of injury recovery. What's going on inside their cognitive profile that I can enhance to prevent an injury down the line. There's some thought looking for scouting and talent screening. I've seen if you want to think about some of the elite athletes that I've worked with that you can see this that they perform so much higher than as you would expect than a high school athlete or youth athlete. So you can sometimes use this to say that this is a really highly functioning cognitive person with an incredible amount of cognitive reserve, great working memory, incredible cognitive endurance, and you can see those differences in athletes. And the beauty of it is, and this is the beauty of the brain, is that when you look at that first point here, our baseline cognitive profile, we can change that. We have the ability to impact the way that the brain functions in space and in time to get to this end where we are talking about looking at elite talent in terms of a cognitive test. So how do you bring it into your workflow? Again, baseline testing at preseason. I think everybody who's using SportGate right now currently does that. Um, the other things that you can think about doing is retesting post game. I like to do that particularly in my contact sports and get them ready for the week and look at how we're going to plan our recovery for that week, not how we're going to manage load, because I don't like to reduce load. I like to keep load exactly where we are. I just like to improve how we're going to recover. What kind of activation exercises am I going to implement? Again, post injury. And then I like to see weekly progression, how the athlete is doing week to week. So post game, post injury, and at least once weekly, so we can see where our athlete is, so we can pick up on any hints of cognitive or physical fatigue before they become a problem. when you do the CPT, always look at it with the gait data as we have been doing in our previous webinars. And then if we make interventions, if we start adding cognitive work into um, our exercise programs, our activation programs, and our strength and conditioning work, we can verify that these things are impactful, or we're having an impact, or something I'm not doing, maybe something I'm doing is not working, and I'll have to switch gears and try something entirely different. So to go through a couple cases, we know when you go into the app or on your desktop to your computer, we get this screen, we can look at the PDF, we can send that off as a report to a parent or a doctor or a physical therapist, anyone who's going to be dealing with the athlete themselves. That gives us one layer of information, an upper level. We've looked at the little view results button. We've done that with all the gait data, and we've done the gait tracings with those as well. And we did a couple webinars looking at the power, stride, symmetry, and balance graphs that we get at that. And now we're going to get down to the section details. We're going to get a little bit deeper into what we can do rather than looking at the little bars. And we're going to dive into the view CPT details. So we're going to show you some of the information that you can get from here. Here is a professional athlete on just a screening, nothing really going on that is worrisome. Just a quick snapshot of where are we before our season starts, how's training been going, where are we, what's my baseline, what do I have to work with. And one of the things I can show you that you can see when you click on this screen is we have all of our cognitive T-scores. Hopefully you can see my arrow or little magnifying glass. We can see all of the T-scores across the top. And with the CPT, the lower the T-score, the better. The higher the T-score, the poorer performing. So we'd like to see kind of lower scores with our CPTs. And then we get the raw data of correct responses, longest streak, 72, which is pretty amazing, zero omissions, 5 commissions. We get the mean hit reaction time, and we get the commission hit reaction time. So go down another layer, we get the practice, we'll see how they do on the practice. Um, and I don't worry too much about the practice because sometimes people just power through it to get through the 30 seconds or so that the practice takes. And then we have our blocks 1 through 9. And within those, it'll show you the inner stimulus interval, 2 seconds, 4 seconds, 1 second, 1 second, 2 seconds, 4 seconds, 4 seconds, 2 seconds, 1 second. So the test will speed up, slow down, speed up, slow down, speed up, slow down, speed up, to really stress those areas of the brain that we talked about in terms of the control over executive function. One of the things I will show you on this athlete that is, what is a really great profile. Each of these blue lines, each line down here is a response, and you can tell which response it is. So the greens are correct X's. So this athlete at this point in time did not hit the X, which is great. So we have no response, right? No line. How many omissions? We see zero omissions, which we have up here. How many commissions? We can see exactly where the commissions were happening, right here. And then the really interesting thing I think from this profile is as we get towards the end of the test, where we're going to see a lot of omissions and commissions are going to be down here in this lower, the blocks 7, 8, and 9. We don't have anything. This is a really highly functional cognitive individual with really great cognitive reserve and reaction time. So we have high accuracy, very great sustained attention, no lapses. The thing that's interesting about this athlete, and you'll have to interpret with whatever athlete you're working with, is a bit of a nuance. We have a slight part of the commission issue with the hit reaction time is we're having a slightly faster than average response time. And that may be good for this particular athlete. This athlete may be trained in a position that has to react very quickly, whether it's a wide receiver that has to make really rapid adjustments and reads and get out of get away from a jamming defensive back or this sort of situation. Someone who has to make very quick decisions very fast. You may see these sort of things where we're having a very fast response, which might not be negative for this athlete, particularly when I start seeing things down here at the end where I'm not having that get worse as the athlete moves on. The athlete here is adapted. We've seen that this person has adaptability. We've understood that we're having 1 second, 1 second, 2 seconds, 4 seconds. The time is changing. I'm able to see that. I'm able to feel it. I'm experiencing it. And then once that is decoded, I've got no more errors. So this is a profile of somebody obviously it's a professional athlete, but this is something that would be in an elite level cognitive performer, whether you're talking about a high school athlete, a college athlete, professional athlete. When you start seeing these sort of really great responses towards the end, we're adapting. We have great cognitive reserve and we're adapting with this individual as well. Again, like we said, we have mental readiness, fatigue resistance is no fatigue later in the blocks. Impulse control is good, but we're moving a little bit towards a increased response, which tells me we have a kind of a little bit of a low inhibition, which may be great for a speed athlete, someone who's a speed athlete opposed to somebody who's not so much of a speed athlete, maybe playing a different position. But the point I made here, it's in the slide again, is that's worth monitoring if that happens increasingly as we have fatigue, and we're not seeing that here. We're actually seeing a adaptation into a highly functional cognitive environment here towards the end, where we're in a normal person like myself, probably we'd start seeing a lot more, emissions and commissions down here in the later part of the test. The other thing that you'll see is if you scroll down on that area is we'll see the heat touch map. And this will show you exactly where the athlete is touching the screen for each of the responses. And you can get some really good information out of here if you take the time to look at it. And it really kind of gives us an insight into how precise are our motors, what's the sensory motor coordination, and our attention control during the test. This pattern is pretty evenly dispersed, and looking at how it's kind of grouped makes me wonder, and it would be very interesting to know, and I don't know the answer to this, if the person may be holding the phone and using both thumbs at the same time rather than just one thumb. Most people might just use their dominant hand to hit the screen. This person looks like it may be using both, which is kind of interesting. Will tell me that person is really highly functioning. If they're using both fingers and we're having really consistent, or both thumbs at the same time, having these really consistent results, then we're really talking about some very well controlled executive function output towards our cognitive system, towards our motor system, which is something that you really see in these sort of elite performances. So we get a nice sort of cluster. It's not all over the place. We're having the orange dots, which are our commissions, kind of happening in the same space. They're hot spots. They're not moving all over the place. So they're not due to mistouches or erratic control or anticipating the test. If you've ever taken the CPT, there's a moment of anticipation where you're waiting for you just kind of hitting on, then you hit an X. We don't have that happening here. We have good impulse control. Um, and no, we'll see some scatter here in a minute, but sometimes you'll see scatter where those dots will be over the place. With fatigue, you might see them in tremor when we're talking about athletes, but if you start using CPTs in a more cognitive um, uh, impairment issues, whether they're neurodegenerative diseases or concussions. When you look at this heat map with the concussion, you might see a lot of erratic responses all over the place because our timing, that visual, spatial, and impulse control issue is dinged in a concussion, and this test will really fatigue you towards the end if you are trying to recover from something like a concussion. So this is really tightly controlled, elite level sort of performance. Things I want to get out of this heat map. We talked about motor control, fatigue effects. Where's the source of the error? Is it cognitive or sensory motor? And that will have to do where how we interpret the timing of the issue or the errors where they're happening. We don't really have a lateral bias here. Sometimes you might see that, and it's worth kind of paying attention to if the athlete is just using their dominant hand. You may see one side or the other. That may be a unique finding of somebody who is just dominant on one side, doesn't really have a hemispheric preference, but you can sometimes see that in issues where we might have cognitive problems in cases like concussion. And we have a really nice neurocognitive sync here. We have really strong integration of what we're processing through our eyes and through our occipital lobe and then out through those motor pathways, we've got a really great coordination of what's happening there. So this can give us a lot of information of kind of high level functioning when we look at where the hits are happening within the CPT timeline of each response. So we've got high accuracy, really good reaction times, and not a whole lot of impulsivity. And the impulsivity we have may be due to the skill position that this athlete may play. And this is where you might think about if somebody if this is not somebody in his skill position, these might be mental errors, not mechanical errors. But if you take the position that the player or athlete has in mind, you'll see this may be a very good thing for the person, that they're reacting really fast and they're adaptable, as we saw with the tracing. This is another elite athlete during a heavy travel situation from a long travel. And first thing, again, we'll point out are the T scores, which are here. Our omissions, we had 5 commissions in the last one. We have 13 on this one. Hit reaction times changed a little. Our commission hit reaction time has changed a little, and sort of a degradation. But one of the things that's really interesting about this pattern, if you come down to block 1, 2, 3 through 9, you'll see we start off okay. We have this period of time where things are going okay through block 1, block 2. We get into block 3. There's a bit, and as we get moving through the test, we start seeing a lot more commissions um, uh, here. So this would be, as we saw in our last athlete, we really didn't have any commissions here in a well-rested athlete with really high cognitive function and impulse control. So we're having a little bit of change from normal for this person. That again is a sleep issue. We have a cognitive fatigue problem, and when we have these errors going on, we think about what's happening to the athlete. We know they're tired, they're not making good decisions, their cognitive reserve is not strong. And what are we looking at? Are we looking at impulsivity, or are we looking at distractibility? Because that's going to tell us what kind of mistakes this athlete may make in training, or if we put them back into competition. So if we think about where we were in our timeline analysis with our previous athlete, we're having a increased impulsivity here, which is telling me that this person is, what you would see with semi-fatigue. They're impulsive. They're really kind of lost that ability to control their frontal lobe, and they're sort of anticipating what's happening next, and hitting or not hitting when they're supposed to be. The hit reaction time is slightly lower, so they're moving a little slower, and we have a longer and more variable response time in those last few blocks, 6 through 9. So we're starting to slow down as we move towards the end of the test. And not only slowing down as we move towards the end of the test, we are also having an issue with uh, making errors and poor judgment. So the this is the greater the amplitude and spread and the height of the bars is telling me control. So it kind of tells me, again, I should tell you at the beginning, the axis on the side is hit reaction time. So hit reaction time is, you can see where it's going up versus going down. So we have this sort of variability in hit reaction time as we're going through each block, opposed to the other athlete where we did not see that. So this is a very good idea of fatigue. The other interesting thing about it is that these sort of reaction time issues is telling me that this person is working really, really hard to pay attention, rather than not. So we're talking about an impulsivity rather than distractibility. If this athlete knows that they're fatigued, and there's maybe a bias here where they know that I'm interrogating the system for fatigue, so they may be working a little bit harder to pay attention than they normally would. So I'll get to that in a second when we talk about the heat map. So in this particular pattern, sustained attention, it's stable, but we have a little bit of hyper vigilant behavior going on, which can make us prone to impulsivity errors. We have a little bit of elevated commission, so we're having a loss of that frontal lobe executive function control. We're having some increased variability, so we're kind of having a leaky system here, as you can see from the hit reaction time. And if you look at the mean hit reaction time, here is the black dots across the the graph, we'll see where the variability is pretty easy to pick out from that. And in summary, with this individual, the reaction time staying the same, but we're losing some inhibition, high commissions, reaction time, no omissions. The athlete isn't disengaged, right? Because we're not missing things. It's just we're sort of overfiring, we're overstimulated, we're working a little bit harder to pay attention because we know that we are fatigued. And if we look at the heat map on this particular athlete where they were touching the screen, we can see an X and Y axis where it's very tightly clustered together. It's in one really tight thing. There's no real sort of smooth distribution that we saw with the other athlete who I think may have been using both thumbs, which is really high level stuff. This is somebody who's probably sitting there with the app, paying really, really high attention and hitting with the thumb really close, or with the finger really close to the screen, and again, acting really kind of hyper vigilant. We don't really have a lot of shift. We don't really have a lot of dispersal. And that tells me that this is we're trying to control our decision making. The brain's reacting, but we're not really uh, acting with fluidity. We're acting really rigidly, and we're really kind of over reliant on what's going on with our visual responses to things, as we're not able to adapt, become very sort of inflexible with how our responses are being done. Here's just a baseline test on a high school athlete to show you a little bit of difference. This is actually fairly normal. I would, when we look at this, we'll talk about, again, there's no again with gait kind of there's no normal necessarily. There's just optimal, and we're going to see a lot of variance in people when we look at these tests. The idea is, how do we optimize it? How do we make it better? And this is pretty typical. This is somebody probably using both hands, kind of hitting on areas that's widely dispersed. They're sort of concentrated in one area, which isn't horrible. It's mostly centered. There are some dispersal of the commission errors, but there's not a whole lot of drift. The visual motor mapping, spatial orientation here looks like it's okay. They're um, the only thing that you could think about here for the with what if you had this athlete as a baseline, and things we can do later on, we'll talk about in the next couple of slides, is that as we see from the elite athlete, is that we don't have that. We have a little bit of inconsistency in our attention, and we're probably a little bit loose. And this may be someone who does a baseline with one of your athletes in August, and it may be just, hey, here's a baseline. The test doesn't count. It's a practice, and may not be taking it with a huge amount of seriousness, just very relaxed, sort of doing the test under not a lot of stress. There is some impulse control issues here, which would point me to think about what I'm going to worry about later on down the road in terms of cognitive fatigue. But pretty normal. You might see something like this in a younger athlete, particularly, or an athlete who's taking this and thinking of it as a something they've got to do in order to get onto the field to play for fall sports. Um, but it's also, you want to look at it in terms of what's going on here with the rest of our line. Is there something happening where we can do with this athlete to improve, tighten that cluster up together, reduce impulsivity, reduce distractibility, um, that will translate into not just better decision making in competition, but also better movements. Because if we can train those areas of the brain that we talked about, the frontal lobe, parietal lobe, and our limbic system, which is going to be part of our reward system and motor memory, if we can make those be more efficient, not only are we going to make better decisions, faster, better decisions in the competition, but we're also going to have a knockoff effect in that our movement is going to get better. We're going to have more symmetry. We're going to have much better gait fluidity, and we're going to be less prone to injury. So the two are very, very tightly connected. So with athletes, I always put some sort of cognitive training into what we're doing. And with somebody who we may be having inhibition or distractibilities, these are some tests, or I'm sorry, some exercises you could probably put inhibitory control drills, go no go tasks, things that would like red light, green light, this would be a a child's game that would have the same idea, but go no go tasks that will force them to pay attention, reduce impulsivity, and have them focus, reducing the distractibility. I find it really important, as we talked about, not just with sleep deprivation, but as an athlete goes through their season, to make sure that we're keeping up with sleep and our recovery. And that will be sleep is the number one thing that you I think the number one intervention you can have on an athlete is trying to increase their sleep hygiene. Sleep is where we restore and repair, getting those pathways to get some rest, repair themselves, regenerate themselves. Um, Suboptimal recovery is where we're going to start seeing degradations in focus, more impulsivity, more distractibility. So aim for as much sleep as you can get. Again, everybody say 8 to 9 hours of sleep. I'm more focused on quality of sleep versus quantity of sleep. It's hard to get people off their phones before they go to bed, but again, that's really very important. So the goal is to try to really hit them with sleep. Hand-eye coordination drills. I see a lot of people do these, ball drop reaction catch, tap boards, tennis ball throws, decision cues. There's some really complicated things you can do with cone drills that with different color cones that you can make them have to move a certain way or go in a certain direction, make a certain cut, move in a certain direct pathway to an end goal based on in drill cues, yelling a number or a color or something to force them to pay attention to what's going on around them and make those decisions while they're at full speed in a drill. That'll help them with that, again, attention and impulsivity. I'd like to work on, before, as part of this a holistic sort of approach. I should have put it up with sleep and recovery, but things like box breathing. I know a lot of special forces and elite athletes like to work on box breathing. It's a technique of trying to really stimulate your vagus nerve, slowing your breathing down, getting the vagus nerve to trying to reset, recalibrate, so you can take advantage of all the healing effects that happen as you get relaxed. Um, as you get that heart rate down and you get the individual relaxed after some breathing, you can then do some um, various visual targeting cues. Uh, there are multiple different techniques to do that, but the idea is to reduce the chatter in your brain during a cognitive task that will allow you to do a physical function much cleaner than if you have a bunch of noise going on in your brain that you'll see with the really distractibility. And then video game, I don't, I just, there's a ton of things out there that are done for, split second decision making judgments. There are apps that are out there. There are certain apps that I use that I use for eye tracking. I find eye tracking is really very key for tightening up a lot of those cognitive pathways that we've talked about. So there's a lot of different drills that you can put in to cognitively stress your athlete while they're doing physical activity to really focus that cognitive output to reduce impulsivity and distractibility. Action plan for trainers or anybody who's using this, track your progress, get your baseline, have an idea of what you're looking at. If you're having fatigue late, where you have somebody with some cognitive endurance. So let's put some cognitive endurance drills into what they do. Um, the brain body sync, dual task. I love dual task stuff, ball tracking, movement decisions. If I'm going to throw a ball one direction, you have to go in the opposite direction, or anything that causes them to make split decisions and sprint work while they're actually doing physical activity can be really helpful. Um, Tempo control things, hold 3 seconds, to those athletes that are showing you impulsivity, pause, react type drills, and use this, the sport gate as kind of recovery screen as they're doing. You get them in to do the sport gate to see where they are on cognitive and gait function once a week. Let's use that as every interaction I have with athletes a chance for intervention. How's our sleep? How are we doing with our hydration? How are things at home? You getting, everybody's got life, new babies, parents, what's going on, everything good, what do you need help with? And then, talk about some of the other things that we can do to improve that. Shutting your phone off before bed, box breathing, more meditative techniques, or things that you can put into play. As a summary of things that you should look out for, hit reaction time. If that starts to change, if we have variations in that, we're looking at somebody who's starting to get fatigued. High commissions, we're talking about poor decision control. High preservations, we're having poor adaptability. And high omissions, we're losing focus and having issues with attention. So if you see those patterns, you start diving deeper into the CPT data, just looking at those bars and the pattern of those bars, where in the 9 block session is your athlete having trouble? Where are they doing commissions? Where are they having omissions? What's the reaction time? You can start to see patterns emerge that you can build into the program that for your athlete, because you should probably know very, very well. And it's easy when you know your athlete to come up with a plan that's going to work um, for them. We're going to send out, hopefully, to everybody here who's registered. We're going to have a little checklist for you to go through to look at what exactly am I going to be looking for in an athlete when I start looking at a CPT, to help walk you through some cases so that you can start integrating this into your practice. And I think that is the very end of my spiel today. So if anybody has any questions, I would be happy to take them, not just about this, but about any of the webinars they may have attended previously.
Perfect. I'm monitoring the chat, so if anybody has any questions, you can drop them there now.
Gotta have some questions. If I don't get any questions, I did a really bad job or a really good job. And I always get where it's a bad job. So somebody throw me a question.
Nothing yet, Pete. I don't know if there's gonna be any questions. There might be some that come through later, as always, if people that view a little bit later,
Yeah.
not as we're live. So we'll keep monitoring those. Send us a direct message. Either one of us will be able to get the answer for you. We'll also be doing some follow-ups as well, so you'll have contact with our team if any questions do come up.
And you can always comment on the YouTube videos as well. I was checking to see if anybody's left any questions there, and I'm happy to answer them there as well.
Wonderful. Well, thank you, Pete. Be on the lookout for the next invite from us. We're going to be taking a week off next week and going to every other week. So in 2 weeks, you'll see the next webinar series information. So make sure you join, and we look forward to seeing you. Wonderful. Thanks again, Pete.
Thank you. Thanks, Beth. Thanks, everybody.